Hi, my name is Melissa, and I'm going to be talking about the face of the lab. What people think of when they think of the lab is not necessarily people working down there. They think of the results getting to them, and they think that their blood is somewhere and their urine is somewhere, but no one really thinks of people working. They just kind of think of machinery, or at least that's kind of what I thought before I went into this profession. So that's going to kind of be the theme of the video today. As you can see, that it's a PowerPoint lecture type of a video. I do have a part 2 that shows a venipuncture, the procedures involved, and the equipment involved. Some topics I'm going to be covering are the lab personnel who work in the lab, which includes the phlebotomist, procedures and why we do them, and the different departments in the lab and the testing done. The phlebotomist. In my opinion, the phlebotomist is literally the face of the lab. They are the people that patients come into contact with the most. They perform venipunctures, aka blood draws, and capillary punctures, aka finger sticks. Phlebotomy, broken down, phleb is vein and otomy is to cut. Alright, we talked about the phlebotomist. There's also the medical lab technicians, MLTs, who do control testing on equipment. They are compliant with safety procedures according to OSHA, and they perform tests on specimens, obviously. Medical lab technologists they basically have the same job description as the medical lab technician. They just have 4 years of school, whereas the medical lab technician has 2 years of school. Venipunctures. Why do we need to have a needle stuck in our arm and blood drawn from us? It can be for diagnostic reasons, like you go into the doctor because something is wrong and you want to find out what it is. A venipuncture or a blood draw can show a lot about your body and what's going on in the least invasive way possible. It's pretty amazing what we can find out with such a little bit of blood. Also, monitoring is another reason to have venipunctures or regular venipunctures. They monitor like medication or treatment that you are getting because of a diagnosis that you've previously had, as well as just making sure that you're healthy. During a physical, you may have a blood draw just to check your cholesterol levels or your potassium, just to make sure that you're healthy. So what happens during a blood draw? If you haven't had a blood draw, I suggest watching my next video, the Face of the Lab Part 2 on my channel. It shows everything that happens during a blood draw, and I go through the steps that happen, so you don't have any surprises when you do get your blood drawn. So what happens? They will ID you. This is the most important step because they don't want to be sticking a needle in someone that they don't need to. They're going to palpate the antecubital area, which is the inner arm on the opposite side of the elbow. Then they will prepare for the draw, so they will get all their supplies together. They'll put on gloves, put the tourniquet on you, and clean the site. They will puncture the site and fill the tubes that are needed. After all the tubes are filled, they will remove the tourniquet, remove the needle, and put pressure on the site with the sterile gauze. And they may ask you to put pressure on if you are able to, while they label the samples. Here are some different tubes that a phlebotomist may use. They all have different additives or lack of additives. The lavender is a common one. That's the second from the left there. That contains EDTA, which is an anticoagulant. It keeps your blood in its form that it would be in your body, other than the calcium levels. The red one is a clot activator, and the yellow one is for blood cultures. Urinalysis. So you go to the doctor and you pee in a cup. It is the least invasive and most cost-effective form of testing. Reasons for a urine sample would be testing that you're pregnant. If you're going to be on a new medication or going to have a procedure done, they want to make sure that you're not pregnant, because a lot of times that can affect the baby. The procedure or the medication could affect the baby, and it's just good information. They will also test your protein and blood levels, which you don't want to have that in your urine. They will test for glucose and drug testing as well. And we all know what that is. Usually before we get hired at a job or on hire, we have to give a urine sample and they test for drug use. A phlebotomist will also perform a capillary puncture for checking your blood sugar as well as your hematocrit if you're going to donate whole blood or plasma. They want to make sure that you're healthy and you'll be able to carry on throughout the day without that amount of blood or plasma in your body. Normal ranges for men are 42 to 51% and women 36 to 45%. Now we'll be talking about departments in the lab. There's the chemistry, hematology, microbiology, immunology, and blood bank departments. The chemistry department, they perform a wide variety of tests of specimens. They'll do like what's called a chemistry panel, which can test a wide variety of different values in your blood. Common tests are glucose, cholesterol, and hormone tests. And the most common tube that is sent to chemistry is the green topped tube. There's also hematology. Hematology is defined as the study of blood. They usually count and classify cells in the blood. We looked at that lavender top tube earlier. Those will be sent to hematology usually. They will test platelet function and coagulation in hematology. Microbiology is the study of microorganisms in your body fluids or tissues. So we're looking at bacteria and viruses here. They can test the specimen against antibiotics to find the most effective way to fight the infection. Immunology is the study of immune products such as antibodies and how they react to foreign materials. Blood bank is where lab personnel cross-matches donor and patient's blood for a successful donation. And there are my references. Again, there's a part 2 of the Face of the Lab. I encourage you to watch that. It's showing the different steps of the venipuncture. Thanks for watching.